Well, welcome back to Tampa Bay's Morning Blend. As we talked about in the beginning of the show, being a mom of three myself, my heart has certainly been with expanding families this time of year in the middle of a pandemic. And this morning, we're talking about why the hospital that you choose to deliver that new baby is so important. And I am so happy to welcome Dr. Lewis to the show this morning from USF Health. And we're going to talk, of course, USF Health also partners with TGH. And again, Dr. Lewis, we were talking before we got started. My heart is with all the families, and certainly you healthcare heroes, as we have been commenting on as well. We're so thankful for the work that you're doing and really ensuring that these families in such a joyful time are staying safe.
Thank you. For us, it's an important time for us to contribute to the healthcare of women all over, because as we have discussed, the pregnant patients and their babies do not care about coronavirus. They are coming, and we can't stop them.
Yeah, and as a matter of fact, 6,200 babies, from what I understand, on average, are born every year at TGH, correct?
That is correct. I call it job security.
Well, that's good. Well, let's talk about this on why where you deliver matters, because as we were chatting before, I think maybe some moms, maybe new moms, don't realize that they have a choice in the matter, maybe.
Well, childbirth is unique in that people come into the situation with a very clear view of what they think they want that experience to look like. And often they get information from their friends or their family members. And a lot of women don't realize that they actually can choose which hospital they deliver at, and they don't know what questions that they should be asking. And so we think it's important to educate patients to let them know that you do have a choice about where you deliver and that there are certain things that you should be asking. For instance, you should be asking about safety protocols. You should be asking about the success rate for having a vaginal birth, because truly those numbers will dictate the likelihood that you will get the outcome that you desire. But also, you should consider your own personal individual characteristics. So if you are someone who's had a prior C-section and you very much desire to have a vaginal birth, well, you should be asking about the hospital's success rate for what we call vaginal birth after cesarean, or it's called VBAC. Because the reality is that your probability of having a successful VBAC is higher in some place that has a high rate of success. For example, Tampa General, which has the #1 rate of successful VBACs in Hillsborough County, and it's #2 in the state for large hospitals. Well, that tells a story. So if you come to Tampa General, because they have such a high successful rate, you're more likely to be successful.
That's so interesting because, again, I think so many people they do talk to their friends and family and find out what worked for them, but that may not be what is the best for you. You mentioned safety too, and I know you guys have really taken strides and are so proud of the safety measures that both TGH and USF Health have done. Talk about those and what people need to know.
Yeah, I think we are very lucky in that within our departments at TGH and USF, we have state and national leaders in obstetric safety in high-risk obstetrics, general obstetrics, and midwifery. And so we are at the forefront of those guidelines and protocols. And so we pride ourselves in leading those efforts, and so we take them back home too. I always joke and say, do not embarrass me. If I'm telling everyone else across the state to be safe, we have to follow those guidelines, and we do. And it includes things like responding very quickly if a mom has an emergency, making sure that we follow existing CDC protocols for things like coronavirus, so that when a woman walks into our doors, that we can provide the most up-to-date care and the safest care so that she and her baby have the best outcomes.
We have little less than a minute left. 2 points I want to hit real quickly if we can. First, midwives. I know that I feel like I'm hearing a lot about that. Are you seeing that more women maybe are choosing a midwife?
Yes, more women want natural childbirth and they want an experience that incorporates their preferences. And so we can provide that with the use of certified nurse midwives. And it's the best of all scenarios because you can have that midwifery care, but also within a hospital setting, have the backup in case there's an emergency. Physicians are there to also help.
Yeah. And as we wrap up here, I know people have so many questions, and this is pretty cool what you and your team are doing. You're putting together this webinar series where people can ask these questions, correct? We're putting up the website. We'll make sure it goes on our website too. But what do you want people to know about these webinars?
They are specifically for patients. We want the patients to know about their options and know about health care for themselves across pregnancy and across their gynecological care. And so please join us. You can sign up for them, and they will be running all summer and into the fall.
Well, again, babies don't know anything about what's going on in the world around us. They are coming. We want to help celebrate these families as well. Thank you, Dr. Lewis, again, for all your time this morning. I know you're very busy. There is the website and a phone number to call to get more information as well. But we appreciate it. We'll make sure it goes on our website.
Thank
you,
you.
Doctor.